Hi, everyone. It's AnneMarie Chiz with AMC Connects, another episode. Got a great one here today. We're going to move pretty quickly. I do have a couple announcements, and it's been a busy few weeks and a busy upcoming weeks, and we get to talk about that. You don't have to hear just me. Again, we've got some great special guests, and also we've got our very first special edition to go over in the event.
Yeah.
Yes, Chuck is just
Love it.
rolling. We're rolling with the new stuff. So stay with me, everyone. Well, welcome back. Another episode of AMC Connects. We're really rolling into the year so quickly. Very excited about that. Hopefully everybody enjoyed last week's episode with Vicki. If you didn't get a chance to see it, it was a great episode. As always, I'm a little biased. Chuck and I, we put so much into it, but it is a really good one. We get to learn a little bit more about Vicki as a person, but as I was reminiscing on that time, a lot of great leadership attributes that Vicki has and has led us through. And I've known Vicki for a while since I've been at Rome Health, and I didn't know some things. So there's some curious things to be able to connect with her on. So tune in if you haven't, everyone. And if you have, as always, give Chuck and I some feedback on the mailbag or through the mailbag. That would be great.
Yeah, AMC Connects 25@gmail.com. Still got it.
We still got it, even though we don't have a lot coming through there, just a couple. Please let us know it's still working, everyone, by sending us a few thoughts, comments, or any topics that you want to make sure hit our episodes. With that, we know that we have a couple announcements. We do have a note that went out, a really important announcement. We talked a little bit about it, that it was coming on an AMC Connects, but here we are. Time goes by fast, like we talk about. As you know, we are launching a new appointment cancellation and no-show policy effective Friday, May 1st. Laminated posters have been ordered from the print shop and sent to respective areas. During the initial 3-month grace period, it will be important for our frontline colleagues to educate patients about the new policy and obtain patient signatures on the agreement as part of the education process. Please ensure that they are equipped with talking points to help them communicate with our patients. And maybe people in the community who are tuning in, I've had a few that have shared with me, they don't miss an episode. We are launching a pilot period to make sure that we are very stewardly with our access points in our practices, and we want to make sure that people show up to their appointments. So, of course, we've had reminders, and we're working hard to smooth out those appointments, but we will have a penalty, so to speak, a financial penalty for missed appointments. So don't miss your appointment. So this will be a reminder that comes out for a period of time. Here are some points to remember for our employees. This policy is about improving access to care so more patients can be seen by us sooner. Because when you do have an appointment and you no call or no show that appointment, we can't backfill and have that access open to somebody who might really need us. Last minute cancellations or no-shows are often impossible to refill, as I said, especially for specialized services. The policy helps ensure every available appointment is used. Exceptions will be made for illness, emergencies, and extenuating circumstances. Exceptions are also made for Medicaid patients. There will be a 3-month grace period to educate our patients and the community. Patients are encouraged to call as soon as possible. Even short notice is better than no notice for all of us. So please be kind with our frontline workforce that are working hard to make sure that this pilot is one that gets out to the community and well understood. Well, last week we had an opportunity on behalf of Rome Health in our area to participate in the Respect and Heal conference. This is now an annual conference. Really thankful for Dr. Mark Corona, the CEO of Upstate Medical University. And he had gotten many of us together a few years ago now, and to see if we wanted to come together on the topic of violence on healthcare workers, to raise awareness, to make sure that, again, we're coming together as a region so that our precious workforce can be safe and that we can get more communication out and maybe even understand what we're all doing to make sure that our workforce is safe and we're open and available to the community. So Rome Health, as well as a number number of other stakeholders had an opportunity to talk about what's going on at Rome Health in terms of respecting and healing and safety in our workplace. We have a couple points to go over, and that went over in that presentation, but strengthening safety through reducing harm. We've had a 65% reduction in workplace injuries from violence since 2021. Really proud of that, because the reduction does reflect intentional system level interventions, some of which we've talked about on AMC Connects, but many people have seen some of what's happened. I think it's really started with a lot of awareness, and really grateful for the leaders across the network that have made sure that first and foremost, our employees recognize that they have a right to be safe and healthy as they come to work and leave work as they have arrived. And as we know and have shared, again, on this particular channel, but in other ways, that society has changed, and then therefore some of the impacts to our workforce has been challenged. But interventions that have driven a safer environment do include prevention and detection. We launched a weapons detection system, and people may not realize, but we've had 615,395 visitors screened since we launched that weapon detection devices. 885 threats have been identified, 67 firearms, and 39 knives. As a reminder, weapons are not allowed on the campuses and the areas of services across Rome Health. Environmental and operational controls, we've increased security presence and proactive rounding over the campus, expanded video surveillance, which we've used many times, safe and simple entrances to make sure that we understand the campus traffic and coming in and out of our sites of care, lobby access restrictions during non-peak hours, partnership and intelligence, reestablish routine collaboration with local law enforcement. Really thankful for Ryan Thompson and Kelly and a number of other individuals. We'll meet again, one right here in the studio, Ashley Edwards, who've really worked hard to make sure that we have strong relationships with stakeholders in the community, first and foremost on this topic with law enforcement. It's important that we work together. Joint review of safety events and high-risk patient scenarios, and accountability and learning, increased security event reporting, root cause analysis, and post-event debriefs. This has been a huge commitment from our quality management team and our operating leaders to make sure that when events do occur, we really understand. We get everybody together to make sure that we, again, understand what's happened, and more importantly, what we can do going forward to maybe prevent them. Frontline staff actively shaping safety improvements and ongoing training. I do want to make sure I have a reminder that awareness is really important. All these steps we've taken are, but they're on a continual basis. We know that this is going to be something that we're committed to over time to make sure that we're the safest organization to give and receive care. So again, honored to participate in that Respect and Heal event, and very excited to be able to continue that journey with our partners and stakeholders across healthcare in upstate New York. Well, it's been an exciting few weeks, as I've shared. Shifting gears a little bit, we did have a wonderful event in honoring, really making sure that we have a clean and environment, and we have the first, I shared that in the introduction, right, Chuck? First AMC Connects Special Edition.
Yes.
So we're going to break to make sure everybody has seen that particular episode. It's quick, so stay with me, everyone.
Well, hello, everyone. We have an exciting episode. It's an AMC Connects, I would say special edition, Chuck, right?
Oh, yeah.
When we say special edition here, a really important effort. It is officially Earth Day. And Rome Health, as always, celebrates by participating in full participation. We have a huge, beautiful campus here on the main hospital and ambulatory campus, as well as we do some things off-site, but very excited to have Rome Health be participating in this. We've had a great turnout here, thanks to Chuck and thanks to Sarah Nobis getting the effort out there with great communications. And we're going to take you through talking to a few people that's here with us. It's great to have a special edition of AMC Connects out here in a beautiful morning in Rome. a friend and a family member of AMC Connects. I'm here with Scott Burns. Scott, why are you out here today?
Well, you know, first of all, Earth Day is pretty important. It's not just, it's nice to actually kind of give back a little bit. And I like borrowing cool tools. So we're just, you know, taking advantage in the morning and making this place look a little more beautiful from the outside because we know what goes on inside.
Like glitzify it, right? As it should, bright and shiny. Like the care we provide, right, Scotty?
That's what we're talking about. I'm just happy to know that we're going to start mowing and the weather is upon us.
And I'm with, the leader ourselves coordinating this morning's event, Sarah. So grateful for you. And when we were debriefing a little bit, when you were giving us our info, you had said that you're pleased. You're pleased with the participation.
Yes, this year turned out a lot more children, so we presented a kind of an incentive, a little drawing for a local place for kids to have fun.
Aww.
And also it's we have a couple of young ladies that are from Honor Society that needed hours for community service, so this has worked out great for them as well.
Oh.
So yeah, probably double from last year, and it's always weather dependent.
Sure, sure. But why is today so important to you?
Today is, we're doing the Earth Day cleanup. We're kind of coordinating with Rome Green and Clean. And depending on the number of people and the number of bags of trash and green waste, we will then turn that into them. They turn it into, I believe it's New York State, and the city of Rome can get money for beautification.
Yes. Thank you again, Sarah, for making sure that we have a great morning. You did something with the weather because we were watching it, right? And here we are, and it's a beautiful morning, very invigorating, and it is one of my most favorite days over the last few years. I've just loved coming out. So thank you for doubling our participation from our workforce in the community, and again for all you're doing.
Well, thank you for coming out. I appreciate it.
Yeah. And I'm with our exceptional Chief Operating Officer, Ryan Thompson. Ryan, you're right out here with us.
Let's go, AnneMarie. Let's go.
I love this. Why is this day? This is one of my favorite days.
It is. It's one of mine too.
Yeah, right?
So a couple of reasons. Number one, look at all the families we have out here. Chuck, if you can give me a little panning. Give me a little panning.
Scan,
Look at all of the families that we have out here working together.
They care.
We've got Scott Burns with the suction backpack on, just making sure that we have a clean campus. And really, clean campus, AnneMarie, is everybody's responsibility.
It is everybody's.
So this is our time. We're going to jumpstart it. This is number two. We're going to jumpstart it. We're going to get the campus cleaned up, and then it's everyone's responsibility to make sure that it stays this way.
Thank you for that reminder, Ryan. And everybody's responsibility means like every day.
Every day.
Adhering to our policies and procedures, right?
Every day.
I was just sharing with people that when the snow melts and people see a lot of the trash and cigarette butts, it brings sometimes our workforce down a little bit. But this day brings everybody up because they know they have a time to come out, commune together, and make sure we beautify the campus.
That's right.
Yeah. And we're here with Danielle Russell. Danielle is an exceptional director and leader for Rome Health, our CRC, and our behavioral health service lines and work that she does in the community. Danielle, why are you here on Earth Day and Cleanup Day? And who is this pumpkin with you?
This is my nephew. That's for me to speak. This is my nephew, and I'm here with my other two nephews just to make sure that they're a part of the importance of keeping everything clean.
I heard you talking to them when we were walking in, Danielle, that you were teaching them how important the earth is, or they're learning how
They were teaching me, yes. I wish Kenai was over here because he's learning about plastic and how litter makes it so our trees can't grow and hurts the earth, so yes.
Thank you to him, and thank you for being here
Yes,
and bringing some wonderful, hopefully future Rome Health employees and keeping our earth and our environment clean.
Yes.
Thank you everyone for tuning into this special edition of AMC Connects. We're so grateful for Sarah Nobis and for everybody who came out today to participate in our cleanup day. A lot to think about in terms of making sure that we are great stewards of this wonderful earth and keeping it local and what we can do close to home, which is making sure that we're devoted to our campuses that we serve in, that we work in, that we play in, And we're really grateful to have employees come out with their passion right here. As we heard from Sarah, we've doubled the participation this year. So grateful for that. It's been an invigorating morning. And as a reminder, making sure that we dispose of trash the way that we should. Again, serving close to home and close to people that are near to us is really what makes our community wonderful, and certainly Rome Health. So thank you for creating the best care out there here.
Thank you, Chuck, and thank you for the special edition.
It was fun.
That was really fun. I wasn't prepared for it. I don't know if that jumped out at anybody that was viewing versus just listening to it. I probably should have known that because I knew Chuck was there and he's always prepared. Nobody was critical yet, but you certainly can be through the mailbag.
Mailbag
but
only.
I was not show ready, we'll call it, and see.
You
if
did
that
great. What do you
jumped
mean?
out
You
yet.
did fantastic.
Thank you. You know, the hair was a
little-
little yeah.
A little AMC on the street. Gotta
There
love it.
was. Yes, it was AnneMarie right off the street. In all seriousness, we had a great time. We had a great day. Snow, shine, rain, cold, warm. It's a great event. If you haven't been to Cleanup Day, it's wonderful. It's just a great way to give back. And throughout the year, I do hear often that people either are really proud of our campus because they're so excited. Well, I think people are always proud. But when there's more trash or things on the ground, it kind of drags people down, as I was sharing in the special edition. So make sure, as Ryan Thompson reminds us, that we're just being mindful of how we discard items. And if we see something, it's all of our responsibilities to make sure our environments are clean and up to date. And I loved that some of the young children that were volunteering and that were present, they were talking about how it's really not good for the environment. Like, the science is there. Not an expert in environmental science, but trees don't grow right, and shrubs and greenery and all of that. So come out next year and celebrate with us at Cleanup Day. It was a huge success. We might touch on that a little bit more because we have the leader in the studio herself that's with us.
Dun,
Yes.
dun, dun.
Before I announce our guest today, I am going to talk about our deep dive is in celebrating Healthcare Week and Nurses Week. Really exciting time for everyone that participates and engages in healthcare, but most importantly, Rome Health. And I was just hearing some updates, and we'll talk a little bit more about it, how the community has really come out in some special ways this year. So we'll get to hear more, but a little bit of the background. Celebrating over 125 years. I didn't really realize this when I was doing some of the background. From a humble beginning marked by a gathering of 8 hospital superintendents in Cleveland, Ohio, more than a century ago, the American Hospital Association and its members have preserved through the decades and many of the challenges and change. Throughout all these years, hospitals and health systems have stood strong as beacons of hope and healing for the patients, families, and communities they serve. Our members' collectively voice and shared commitments to advancing health in America has led to the field with dedication, innovation, and collaboration. Over 125 years of celebrating Healthcare Hospital Week and all the related events from the American Hospital Association. They really reflect and help us honor. A little bit more of the background. Chuck, don't know if you knew this. 1918 to 1921 was really where the start of celebrating Hospital Week.
I knew
that.
that.
Was its origin. Okay.
No, I'm kidding. I'm kidding. I knew nothing about
I
that.
love how honest you are, Chuck. And nobody would have known. You could have just rode the wave. This was following the influenza pandemic. The public needed reassurance, leading to a designated day to highlight hospital safety and care. Interesting. Florence Nightingale. The week aligns with the birthday, May 12th, of the founder of modern nursing, whose work in the 1800s revolutionized patient care. I love that we emphasize this. We'll hear more from another guest. In 1953 extension, the observance was extended to a full week by the AHA to allow for more comprehensive public information and employee recognition programs. Modern day, National Hospital Week is now typically celebrated around May 10th to May 16th, focusing on recognizing the dedication of staff and advancements in technology. Here with us today, 2 very special guests, Sarah Nobis and Ashley Edwards. You both, thank you for joining me. There's been so much put together. Maybe we'll start with Sarah. Let's go back just a couple minutes and the cleanup day. From your perspective, how did it go?
This year was very successful. We probably had at least 10 people more than we did the previous year. It does help when we don't have rain coming down on us.
Yeah,
It would have been better if the sun broke out, but we did have quite a few more people and a lot more children
Yeah.
this year. So I like that. I
It-
like that we're getting the kids geared and attuned to that.
Yes, volunteer service should just be kind of like a permanent part, right, of the way we connect with the community. So thank you for the opportunity. It is actually one of my favorite days and events within Rome
Thank
Health.
you for coming out, even though it was really windy and a little chilly.
It
a little
was
chilly.
windy, but when you bend over at least 1,000, 2,000 times, you get nice and warm.
I got it.
And a sore
I got
back.
warm.
Yeah.
And a good workout.
Yes, I felt like while I was, it's not really steps, but like there were some steps.
Oh,
but
yes.
yeah, the
Oh, yes.
squats are like really good for you.
Excellent squats.
Yes, great. Thank you so much for coordinating that event for us.
Absolutely.
We'll start with you. You are helping us through celebrating Healthcare Week. Tell us a little bit more.
Yes. So we kind of overlap a little bit between the Nurses Appreciation Week and our week. So starting on Monday, we've got events all week long, and they accumulate on Friday, where we have the annual luncheon for all of the staff, and then we will have the Employee of the Year awards. And generally, we take every single month we have an Employee of the Month.
Yes.
And then we have, usually we try to do a clinical and a clerical, or sometimes it's a both. We have a whole metrics. And then we take those, all of those nominees, and at the end of the year, we re-vote on who deserves it the most and who had the biggest impact. And then we award 2 at the very end of the week. And
It's very special.
it's very nice.
Remind
It's
us
very
the attributes of that we highlight the most that would be, to be able to receive one of those awards.
So we have a voting system, and anybody can nominate. So some of the criteria is we have people that it can't just be, oh, so-and-so goes above and beyond. So-and-so is great. Tell us why they're great, because we want to make sure that we're being very specific about why we're giving them the appreciation and honoring them. We like to make sure that they're making an impact to the hospital. One of the items is safety. It's just we get so many nominations, and they just range all over there.
I think it's one of our greatest organizational attributes, right? Is that whenever I've shared this before, but it's deserved in this context, whenever I ask our teams across the network what they're most proud of or who they're most proud of, they really struggle because we really score very highly on working together as a team. It's just one of our amazing fabric points. But I'm glad you're going deeper, and the committee's going deeper on really unpack that a little bit, a who and a specific why, right? And I really appreciate safety. And that seems like a real commitment to kind of policies and procedures and the organization's approach to safety, right? Well, it seems like you're excited about some of the other events of the week. Can you give us a sneak peek of what else is happening and maybe who's helping us celebrate?
Okay, so we've actually had some community members and businesses donate time, items. So on Monday, we are going to have a sweet treat. Truck is going to come, sponsored by First Source Credit Union, and they are going to have all sorts of slushies and snacks for everyone. And then also on Tuesday, we have a photo booth, and all of that was also donated, the time, the setup. And so that made it so that by saving that money, then we can then turn around and give it back in other ways. So this year we ordered some really good swag items for the annual prize wheel.
And we love our swag.
Love the swag.
Helpers, we do. What are you most excited about in the swag? Can we talk about it, or is it a surprise?
Well, it's kind of a surprise, but
She's like, well.
the thing that all the new items that we voted on, the thing that people like the most is it's a small first aid kit, and it's in red, and we've got our Rome Health logo on it, and it's just a nice little thing to put in a purse or in a car or in a desk, and I think people are going to really
Because
like
you
that.
just never have a Band-Aid when you need
Never
it.
have a
It's like an umbrella. Yes.
Exactly.
That's a great one, Sarah. Thank
So I think
you.
people will like this.
I feel like you're really excited
I am really excited.
for this week.
I think this year is going to be better and different than what we've done in the past. We've kind of always done similar things. So we kept all the things that are people's favorites. And then
Aw.
also giving a little bit different and, kind of spicing it up a little bit.
Yes. And, kind of speaking of volunteerish, I mean, this is like above and beyond. You and other members
It's a lot
of
of
the
extra work.
Yes, but you shared something in the special edition that this is something I think you had shared with me. It's kind of icing on the cake.
It is. It is. Where I'm working, I'm in my office all day long and I'm doing work and I feel like I'm doing work that matters. But I feel like there's like a little bit of missing of the connection.
Mm-hmm.
So the Employee Health and Wellbeing Committee, that's how I kind of gain connection to other departments, other leaders, and just see what's generally going on, because I can't really take like the pulse of what's going on at the hospital when I'm a little bit removed from that.
Yeah.
And it's good to know what's
What a
going on
great
with
way to
everyone.
look at it. It's like expanding your family, expanding
It
your
really
team.
is.
Right?
It really is.
Oh, Sarah, thank you. Thank you for facilitating. And we're going to come back to you in just a minute. But Ashley's with us. Ashley's been with us on AMC Connects. We're so glad to have you back.
Returning!
Yes, because we know how busy you both are. So to spend some time, I really appreciate it. But Ashley, talk to us about what's coming first with Nurses Week.
Sure. So Nurses Week will overlap with Healthcare Week this year because it always ends on Flo's birthday. So, sometimes we overlap, sometimes we don't. But we are launching our awards ceremony on Monday morning with our awards breakfast. So we have our typical awards that we use. We do Rising Star for anybody less than 2 years. We do a Nurse of Excellence, a Transforming Leader, and then we do a clinical ancillary partner of excellence, and then a non-clinical ancillary partner of excellence. So we really like to bring in, even though it's Nurses Week, we can't do it without everybody else. So we always make sure that we recognize our non-nurse partners that make it possible.
Well, that is awesome because it's a full team, right? And I love that you call it Flo's birthday. Flo,
Yeah.
we love Flo. I really appreciate that Rome Health nurses honor her and the legacy that she laid out, because I think we talk about this sometimes. I think she still gives us that energy on how transformative employees, but certainly nurses in the profession of nursing can be. So what are you most excited about? Because there was a little exciting but snafu last year. I don't know if you want to bring us back to that or if we're just moving forward.
Was it the breakfast?
Oh, the breakfast! I forgot about.
No,
it.
that
I
was the
thinking-
recognition breakfast. That wasn't this one.
I was thinking
No.
the T-shirts.
Oh, the T-shirts, yeah.
They were beautiful, and it was such a great idea.
Yeah, it was really busy. It was
so busy.
It was really, really well liked, which is great.
Yeah.
I don't think we had any anticipation. The line was out the door. So we did make your own T-shirts where we had the vinyl was already pre-printed, and then they were doing the machine there, but the line was out the door. And I felt our partners at Upstate and Can Thread that helped us with a lot of our swag got a lot of
Overwhelmed.
business. It was yes, very overwhelming for them. So this year we're still doing the same concept, but we're having them pre-made. So there'll still be 2 different colors that you can choose from, the royal blue or black. There's going to be 3 different options, but they'll be pre-printed. There's also going to be a tote bag option this year for our colleagues that wear hospital issued scrubs and don't have the opportunity to wear a t-shirt at work.
Yeah.
So there'll be a tote bag option.
That is wonderful. I just want to say to everybody, and Chuck, chime in here with me. These 2 leaders making such a special couple weeks for us, taking into account last year, previous years, this year, and how can it be better? I mean, I'm so proud of that because it almost doesn't matter what we're doing and working on. We want everybody happy and fulfilled and safe, and the committees and the people influencing this work care so much for us to have just the next greatest experience. That's what is occurring to me as you 2 are sharing the work that's gone into this. What are you most excited about, Ashley, for Nurses Week?
Nurses Week is my favorite week, so I'm excited for it all.
Spoken like a great CNA.
We are having our nurse coach come, and she's doing a guided meditation lunch, and we're going to offer a Zoom option as well for our offsites to be able to participate. She's phenomenal.
Yes.
Everybody that comes in contact with her loves her, but being able to offer it to a larger group session. So we'll be doing a 12 p.m. and a 12:45. So there'll be 2 options that people can rotate through. So I'm really excited about that.
Yes, and we typically have really good participation with her, right? Yeah. I got the opportunity to be a part of a guided segment at one of your
guided
leaderships.
meditation that she did
Yes,
with
the
us.
guided meditation. And I've always been that person that is I'll just work harder and do more. Maybe I'll go for a walk, or a run, and that's going to kind of fix some of the, what my brain might be going through or my emotions. And so I know that you had been prioritizing this for the workforce for some time. And so I was going to kind of I'll just multitask, I guess, when it is what it really purposed, because she did a background. Sarah, I don't know if you've ever been through it, or Chuck.
No.
It was very helpful. And she kind of backdrops it and really says that understood, and she gives a lot of freedom in it. It was wonderful, Ashley. I think it's an amazing priority for all of us. I mean, I clearly was humbled. I mean, I don't know that was the take back, was to have more of a to-do list, but trying to figure out how to have this part of our lives.
Yeah.
Right?
It's really great. And I think the same thing for all leaders. Everybody's like, guided meditation.
Yeah.
But when you put all the leaders in a room and you force them to do it, then they were like, oh, that was really nice.
It was really nice. It felt like it was hours long, and it wasn't.
15 minutes.
It was 15 minutes. And I did feel like I could breathe better, and things seemed more organized. So that's your favorite part of Nurses
I'm
Week.
excited about that.
Oh, great, great. Well, what could both of you share with us that you want us to know and be a part of with these celebrations? What would uplift you guys and the people around you that are working so hard for us to have some really special weeks?
Well, I just hope that more people are able to participate. We've moved hours around to try to accommodate people coming in very early or leaving very early, and then throughout the day, and just hoping that the leaders will also give them maybe like 5-10 extra minutes to just so that they can pop in up at the classroom and participate. And we're also worked really hard to make sure that we included all of the off-sites, even the ones as far as Camden and Boonville, to make sure that they also feel appreciated. And I hope that they enjoy what we've put together.
Awesome. Thank you, Sarah. How about for you, Ashley?
I think same thing that Sarah's talking about, but I think what's really cool about this year is we work kind of like together through Unit Practice Council too. So Sarah attends Unit Practice Council for us on behalf of Employee Health and Wellness. So making sure that we're aligning and that we're offering things, not just during Nurses Week for nurses, but for everybody. And that, we have 2 days that overlap that are going to be really fun filled, Monday to Tuesday. So
The overlapping days. I love it.
really
And I had said earlier, the nice part is Nurses Week starts off with their awards and celebrations, and then we end Healthcare Week with more awards and celebrations. So we're kind of like sandwiching it.
Yeah.
Congratulations, you guys. I'm saying that before we watch the outcomes and people participate. I'm so excited. I know there are many people looking forward to the celebrations both these weeks.
Yeah,
but for you guys to, like you said, Ashley, to overlap and to be working together, it's just like leading practice. So thank you both. Well, speaking of participation, Sarah,
Uh-oh.
we have participation tokens here. You can choose which AMC Connects sticker to help get the word out. Okay. Is it
One more.
completely?
One more.
There you
There you
go.
go.
Yeah, there you
I
go.
really
Ooh,
appreciate it.
yes, I would really love the AMC Connect.
Oh, great.
Thank
And
you.
Ashley, you had one with your last participation. Is this the one you got?
No, I got that one. So I'll take that
Oh,
one.
look at that.
Perfect.
Thank you.
Thank you guys. Thank you guys again. Really appreciate the leadership here and very excited. Please, everyone, take Sarah's note and ask and participate. And us as supervisors or people supporting and serving all of our workforce, if you can, please create that time and space. I know the schedules have been kind of out there a little bit of what's happening, but when they're formally out, right, make sure that you carve out that time for our workforce to participate and celebrate all the work that we can do, that we do throughout the year, and be able to celebrate our colleagues that are getting awards as well. And I know I look up to people that have these amazing attributes that live out the mission, vision, and values here at Rome Health each and every day. So thank you to you both and all of you for creating the best care out there here.